Welcome. I am Terry Tropin, and today I'm discussing the new ICD-10-PCS codes for 2022. Remember that these will be effective October 1, 2021. So let's find out about the changes. But first, let me tell you a little about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHIMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the confusing coding guidelines. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external causes. These are available on Amazon. So here's an overview of the changes made for 2022. So for 2021, we had 78,136 codes. For 2022, we have a little bit more, 78,220. 107 were deleted, 191 were added, 62 were revised. So that's an overview of what we've done. Now, I'm not talking about every single change that was made to every single table, because some of them are just minor. But I'm going to talk about the big changes to the guidelines, changes to the medical and surgical tables, and changes to other tables. This is a really helpful website if you're not familiar with it. This is Centers for Medicare and Medicaid Services website, and that has a list of all of the new codes, the new guidelines, the new tables, all of that. It also includes the materials from the ICD-10 Coordination and Maintenance Committee. This is really helpful because it talks more about not just the changes, but what the new procedures are used for. It gives a description of the procedures, what condition is it trying to treat, which you don't really get from just the tables on their own. So this is a really helpful site to check out. So first, let's look at the guideline changes. Root operation control had changes to it. So here you have 2021 wording, here you have the 2022 wording. You see here in bold the differences. So it gives an example of what do you mean by controlling bleeding. It's to achieve hemostasis beyond what would be considered integral to a procedure. So every op report ends with hemostasis achieved, right, hopefully. And that's part of the procedure, that's included. That's not reported separately. But for control, you use techniques such as cautery, application of substances or pressure, rupturing or ligation, or clipping of bleeding points at the site. Now, first of all, it's beyond normal hemostasis. Also, the second factor is it wouldn't be reported with a different root operation. So if in order to control bleeding, they have to, the physician did an excision or a detachment or reposition, resection, then you would use the other more specific root operation, not control. Okay. So also in 2021, they had an example resection of spleen. Well, that's a little vague. So for 2022, that was crossed out, and they have new examples. So here are some new examples. When would you use control and when would you not use control? So silver nitrate cautery for nasal bleeding, that's coded to control. Liquid embolization of the iliac artery to treat hematoma, that's occlusion. So what they're trying to do is occlude the artery, and so that would be an occlusion, not a control. Suctioning of residual blood to achieve hemostasis, well, that's routine, so that is not coded separately. That's part of whatever other procedure was being done. So here's a change to body part values. you see here, this is a big difference. So this involves tubular body parts. So in 2021, it says code to the body part value corresponding to the furthest anatomical site from the point of entry, from where the physician entered the tubular body part. In 2022, it says the anatomical part closest to the heart. Okay, so that's a big difference. And here's another change, but I think this is illustrated best on the next slide. So if the physician goes in at the femoral artery and goes up to the iliac artery, you code it to the iliac artery because that's closest to the heart. If the physician goes in the iliac artery down to the femoral artery, you still report it to the iliac artery because in both cases, it's the iliac artery that's closest to the heart. Now, in the previous guidelines, the guidelines in effect now, that will be different because where you started. So it's not where you started, it's which part is closest to the heart. So that's a big change. So here's a new technology guideline. The guideline concerns reporting whether or not you use a new technology code only by itself or not. So the difference is in the example. So this example is in 2021 is XW04321. In 2022, it's this one, XW04386. So this one is no longer a valid code, so they had to change it. So they did it from one anti-infective to another anti-infective. But the sentence, the most important part of this is that a separate code from table E30 for administration is not coded in addition to XW04386. That's the most important factor in here. So also in the new technology guidelines, and again talking about whether you do one code or two, there's an example. Multiple procedures using new technology codes are coded following the multiple procedure guidelines. So they use the same example, the dual filter cerebral embolic filtration, but they deleted this one and they added this one. Now this code, this was a valid code in 2021, but they just changed it to make this the example rather than the magnetically controlled growth rod. So this is an extracorporeal flow reversal circuit for embolic neuroprotection placed during a transcarotid arterial revascularization procedure. Code from table X2A is coded with code for the transcarotid arterial revascularization. So and this is a case where you would use two codes. So it's just a matter of changing the example that they used. Okay, so that's the changes to guidelines. Let's talk about the changes to tables. This doesn't include all the changes because some are minor, but these are the ones that matter and that have procedures that may be unfamiliar, certainly unfamiliar to me in many cases. That's why I love coding, because I learned so much about what's going on in medicine. So in the surgical section, we have changes to central nervous system, cranial nerves, heart and great vessels, upper arteries, lower veins, upper bones, lower bones. So in other sections outside the surgical, we have changes in administration, measurement and monitoring, and primarily in new technology. Lots and lots in new technology. So first, let's look at table 00D in the central nervous system and cranial nerves. The body values were added for brain and cerebral hemisphere. These are to report procedures such as microsurgical hemispherotomy performed using Cavitron ultrasonic surgical aspiration. Okay, so what you see from the picture, which is why I love pictures too, it makes it clear. What they do is they use the ultrasonic method to get to the tumor and then this tissue over here and the tissue over there is not affected. So this is a new procedure for extraction. So they're getting rid of a tumor. Okay, we have a number of changes to the heart and great vessels body system. We have 4 of them. 2 of them refer to heart replacements, transplants. Table O2R, they have a new body system for a body part for heart, A. And then they have a new device value for syncardia, total artificial heart. So this uses external pneumatic drivers, meaning air, to push blood in and out of the heart. It's pulsatile, which is in pulses, and uses mechanical valves. In this case, the diseased heart is removed and a temporary heart is inserted until a donor heart is available for the patient. Another replacement heart is the Carmack electrohydraulic heart. This is a electrohydraulic heart replacement, uses fluid and electricity, and the pump is inside the body. There's external equipment containing a controller and battery pockets. This also is in pulses, and this uses biological valves. And this one is more of a long-term replacement. Remember, we said the syncardia is temporary, although temporary may be sometimes, since hearts are to transplant are not that easy to find. So let's compare the syncardia and the Carmack artificial hearts. So the syncardia, which is device value M, is temporary, external drivers, so that what the mechanism is external to the body. Air and the valves are mechanical. The Carmack is long-term, and that's value L. The drivers themselves are internal, although there's a pocket for battery and such outside the body. It uses electricity and fluid, and the valves are biological material. So 2 different kinds of heart replacement systems. Another replacement procedure in the same table is a replacement of the pulmonary valve. This is also in 02R. New body part value H for pulmonary valve, and this is zooplastic tissue and the native site. So what this does is uses a catheter to replace the valve at its original site. And this is an alternative, a really good alternative, rather than using open heart surgery, which is has a lot more risk. This is performed on patients with tetralogy of Fallot, with either pulmonary valve stenosis or pulmonary atresia, and also for some other congenital conditions involving this valve. So this is use of a catheter instead of open heart surgery. Another change in the heart and great vessel system is 02F fragmentation. So they added body part values for the coronary arteries, and then fragmentation. This is for intravascular lithotripsy to treat calcified lesion in the coronary arteries. So it goes into the skin, through the skin, to treat lesions in the coronary arteries. Okay, the next body system we're going to talk about is the upper arteries, table 03F, again fragmentation. A new body part was added for intracranial artery. This is used for procedures such as clot maceration performed in the cerebral artery using a microcatheter, and it's percutaneous. So what's clot maceration? Clot maceration means to pass a guide wire through a clot multiple times in order to fragment it. It can be ultrasonic or it can be no qualifier. It depends. It will differ. The body systems for upper bones and lower bones have changes to the root operation reposition. A new device value spinal stabilization device for vertebral body tether was added, and that's here. So what is this? This is a way to treat scoliosis in children without using fusions, without limiting. A fusion, of course, limits the ability for motion. So what this does, it's devices that hold and straighten the spine while the patient continues to grow. And you can see this is before surgery, this is right after surgery, and here are the tethers. And then 2 years after that, you can see the difference between this one and this one. Big difference. So this is kind of interesting. Okay, so that is all the changes in the medical and surgical section that we'll be talking about. Moving on to other sections, let's look at administration, table 302. This is the circulatory system, transfusions. So there's a new substance value, D, pathogen-reduced cryoprecipitated fibrogen complex. Okay, and here's a picture of that. So this is what you end up with. So this is for patients with massive hemorrhage, and it's made from frozen plasma and helps, fibrogen, of course, is a component of a clot. So this is important. Okay, measurement and monitoring section. We now have a function device value W for cerebral spinal fluid shunt with a qualifier wireless sensor. So see this thing right here? That is over the cerebral spinal fluid shunt, and it measures the flow through the shunt, so you know that everything's functioning well. So it's just mounted on the patient's neck by the shunt. So there are a lot of changes, lots and lots of changes in the new technology section. So first of all, table X2J, cardiovascular system inspection, at a body part value A and a device substance value for transthoracic echocardiography computer-aided guidance. So this is a computerized way to assist getting ultrasound images of the heart. Also in the cardiovascular system new technology is a change to table X2C, extirpation. New body part values were added for abdominal aorta, veins, upper, lower, right, left, arteries, and great vessels. This is for computer-aided mechanical aspiration. You see this guy up here in the corner. He's doing surgery while he's watching a screen that helps guide the aspiration procedure. Okay, so we also have a new table, X2K, for bypass. This procedure uses thermal resistant energy, it's in here, to create a AV fistula for hemodialysis patients. So the thermal resistant energy helps form this anastomosis here. So also in the cardiovascular system, we have a table X2R. A new body part value was added for a thoracic aorta arch. The device value is branched synthetic substitute with intraluminal device. Okay, so this combines the replacement of the thoracic aortic arch and restriction of the descending thoracic aorta. So it does both of them together. And it's branched like this. Okay, so new technology for gastrointestinal system. We got a couple of those. So a table was added for monitoring, XD2. The device value is oxygen saturation. So this gives a full color image for visualizing the hemoglobin oxygen saturation levels of blood in the superficial tissue using 2D endoscopic images. And you can see that here. Okay, the new table also in the gastrointestinal system, XDP. This is irrigation. This uses the device intraoperative single-use oversleeve, a device that fits over the endoscope and helps clean out the colon. You see how this thing is shooting water? It helps cleans everything out. So it fits over the colonoscope to clean out the colon and avoid having to abort or delay the procedure because they can't see what they need to see. Okay, so it kind of cleans everything out, and it's a single use. Okay, and this is used for colonoscopies for GI bleeding and other related conditions. So when it's not cleaned out well enough, it can use this. Okay, bones, XNS, this is reposition. This table is a new table, and it's for procedures on the lumbar, cervical, or thoracic vertebrae. The new device is posterior distraction device. This is really interesting. So the patient has decompressed vertebrae. They're kind of pushed into each other. So this device is the distraction device is inserted, and then after it's implanted, the device can be opened up, and that will lift the decompressed vertebrae. See the arrows here? So it's put in, it's decompressed here, and then it's put in and moved. That's what dynamic means, so that it makes more room. It's not all pushed together. So here's another one for joints, XRG. This is for a new device, intraoperative fusion device, customizable. This device is used for correcting adult spinal deformities to meet the needs for a specific patient. You see the blue, these here, those are screws, and they can go in, the physician can go in and adjust the device by using the blue screws. Fascinating. So this is an interbody fusion device, customizable. There's also a new row in new technology, XHR, replacement. The body part value is skin. The device is bioengineered allogenic construct, which is a skin replacement used for burn patients using the patient's own skin cells. Okay, so it's bioengineered here. Okay, so new technology and physiological systems. This is measurement, XXE. This is a new device, pulmonary artery flow, computer-aided triage, and notification. So this uses artificial intelligence to detect pulmonary embolism with CT pulmonary angiograms. And you can see that in the picture here. Also in the physiological systems section of new technology is a new device, R, which is infection, mechanical initial specimen diversion technique using active negative pressure. Boy, these are getting really complicated, aren't they? This is used to drain off the initial specimen of blood taken, since it is more likely to be contaminated. So they get rid of that first section, which is more likely to be contaminated, and then look at the rest of it. Okay, so this is a single-use collection device. And so this part is gotten rid of, and they use this part, which is less likely to be contaminated. Okay, so added to also XXE, measurement physiological systems. we have a new device, intracranial vascular activity computer-aided assessment. So this is the aspects to evaluate stroke patients. It's Alberta Stroke Program Early CT Score. And so you can see, you go through the score and each different colors for different areas, and they add up the points, and here's the total point, and that evaluates stroke patients to see how they're doing, to see the damage done by the stroke. So another one for measurements is table XXE measurement, and this is two codes, two different procedures reported together, but two different codes. So it's the test to determine the cause of a stroke. It's based on blood samples for mRNA expression and nasal swabs for respiratory status. So you have blood samples and respiratory samples. So you code for the blood, body parts, circulatory, external, mRNA, and then for the nose, body part nose, infection, nasopharyngeal fluid. So it's two different procedures reported in two different ways. Usually they're done together. Another new table for new technology is for anatomical regions insertion, XWH. The new device is a neurostimulator lead. It's right here. So this is a procedure that uses electrical stimulation to treat neurogenic dysphagia, swallowing problems, which often occurs with stroke, trauma, or inflammation. So the catheter is passed through the nasal cavity, pharynx, and esophagus until the tip is in the stomach. So this provides stimulation for dysphagia. So also added to table XW0, introduction, there's a lot of new substances. And I'm not going to try to read all of these because I stumble over the words. So you have new values for device substance technology. These are substances. So for burn patients, you have this one. For patients with small cell lung cancer, you have three new ones, three new substances. For patients with problems with the side effects of chemotherapy, or patients with metastatic SCLC. And then you have a substance for patients with neuromyelitis optica spectrum disorder, and also for patients with multiple myeloma. Okay, another two technology table is XY0, extracorporeal introduction. This is for an anticoagulant substance used with a dialysis circuit to keep the blood during dialysis from clotting. Now, usually at this point in my videos, I talk about notes to make in your coding books. Well, you don't have your 2022 coding books available yet, so I can't really do that. When you get your books, either go back to this video or look at that website that I mentioned at the beginning of the video that has the information about the committee, the Coordination and Maintenance Committee, because that gives you a good idea of what this stuff is used for and gives you more information than I talked about during this one. So, that completes this video. If you have questions or comments, please feel free to contact me. I will be posting videos, more videos in the future, next week or so. And here again are the books I've written on coding, available on Amazon. Please subscribe to my channel. I try to put something up about once a week or so, sometimes more often, depending on how complicated they are. Thank you so much for listening. I hope to have more lessons up soon. Thank you.